At Cathedral Center, we monitor safety by having one staff person on each floor at all times during waking hours. And then around the clock, so including those hours where clients are sleeping, staff are expected to do hourly security checks where they literally walk through the entire building and make sure that everything is as it should be, and then they're also able to intervene if they observe anything that might be concerning or safety related.
So the way that we monitor the behavior of the adults that are working with young people is through a scaled responsibility chart, I guess you could say. The people that I'm responsible to report to monitor my behavior. So what that means is, on a weekly basis, I have a one-on-one conversation with my supervisor. I'm letting them know what it is that I'm going to be doing. My supervisor is always going to know the programming that I'm going to be implementing, the number of young people that I'm going to be implementing to, and what and where and when it's going to happen. That it's a way for our organization to know specifically what our ground workers are doing with the young folks and keep an eye. And at the same time, then our supervisors are invited to come in and actually observe what we're doing. Not only to make sure that the program is going the way it's supposed to be doing, that we're implementing the things that we're supposed to be implementing and reaching the goals we want, but also to ensure that young people are actually engaged, young people are enjoying the time that they have there, and young people feel like this is a space that they can be in safely.
Big Brothers Big Sisters has policies set in place to protect children and minimize their risk for abuse. Having policies and procedures and guidelines for our volunteers and children is a really important aspect for us to be able to monitor that. Examples are, having volunteers interacting with us on a regular basis. We also, are communicating with our match participants on a regular basis, and so making sure that they understand that is an expectation and they must be in contact with us even if things are going well. We need to hear the good things, but we also need to ensure that the match is developing in a healthy way and there are no concerns.
If there are agencies out there who have not implemented a reflective supervision practice, they really should, because the key to caregivers providing great care to vulnerable consumers is their own personal health. And reflective supervision is about paying attention to who you are as the caregiver as you go out and deliver that care. So it takes a certain set of eyes and certain set of ears to listen to what that caregiver is saying and what they're saying about the nature of the relationship they have with the consumer. And that's what makes it very powerful and very effective in picking up on inappropriate behavior.